Chapter 13 and 14, Developmental Nutrition. Let's start with pregnancy. A mother's nutritional status and weight have a big impact on the health of the baby. A woman who is underweight is likely to have a baby who is underweight. And the single most important indicator of an infant's future health is birth weight. A low birth weight baby is less than 5.5 pounds at birth. The characteristics of a low birth weight baby is a low adult IQ, short stature, and the baby is 40 times more likely to die within the first year of life. So let's look at the nutrient needs during pregnancy. This figure here, is also in the book, shows the nutrient needs in non-pregnancy, pregnancy, and lactation. Protein and carbohydrate needs both increase during pregnancy and lactation. Fiber and fatty acid needs increase, but not as much. The fat-soluble vitamin needs don't increase during pregnancy much, but needs for vitamin A and vitamin E increase during lactation. Most of the B vitamin and vitamin C needs increase in both pregnancy and lactation. We've talked about the importance of folate during pregnancy. Folate is very important for neural tube development, which occurs during the first few weeks of pregnancy. The recommendation increases from 400 micrograms a day to 600 micrograms a day during pregnancy. Low folate intake is associated with spina bifida, the most common neural tube defect, and anencephaly, in which brain development fails. Most of the mineral needs increase, but a notable exception is calcium. Although the need for calcium increases, the absorption of calcium doubles, and any more calcium needed is pulled from the mother's stores in her bones. Iron needs increase substantially, and the absorption of iron increases threefold during pregnancy. But this is still not enough. The fetus needs to develop a store of iron for the first 4 to 6 months of life. Supplementation is needed. This is also true for zinc. After the infant is born, the mother will choose to breastfeed or formula feed her infant. There are some tremendous nutritional advantages with breastfeeding. Breast milk is designed especially for the infant. The carbohydrate in milk is lactose, a simple sugar which is easy to break down. Breast milk has generous amounts of essential fatty acids, important for growth and development. The protein in breast milk is easily digestible, and there are ample amount of vitamins and minerals. One notable exception is vitamin D. It is not high in breast milk, since the body can make it. But with higher rates of skin cancer, most pediatricians are recommending sunscreen and full clothing for infants when in the sun. So vitamin D supplementation may be necessary. Also, the iron in breast milk is ample for only 4 to 6 months. After this, supplemental iron is necessary. Colostrum is not really part of breast milk. It is a pre-milk substance produced during the first 2 to 3 days of lactation. It contains antibodies and protects the infant from infection. As the newborns grow and become toddlers, their diet changes. In fact, the diet changes more for a toddler between the first and second year than at any other time of life. A typical U.S. diet will usually provide enough protein for toddlers, but the carbohydrate need is high. A 1-year-old's brain is large for its body size. The brain uses glucose for fuel, so the carbohydrate need is very high. The minimum fiber requirement is the toddler's age plus 5 grams. The fat requirement is higher during the ages of 1 to 3 years. Cutting out trans fat and limiting saturated fat is okay, but a low-fat diet can inhibit growth and development. Iron deficiency is common for toddlers. The recommendation is 7 to 10 milligrams a day. A healthy diet is extremely important for toddlers and children, although it's well known that many children are very picky eaters. It's important to know the difference between food allergy, food intolerance, and food aversion. Food allergy is a result of the body recognizing a food protein as foreign and then launching an immune response against the protein. This triggers an allergic reaction. A food intolerance is just an uncomfortable feeling as a result of eating certain foods. The most common is lactose intolerance. Those who do not have enough enzyme lactase cannot digest lactose, milk sugar, and end up with bloating and abdominal pain. This is not an allergic reaction. Food aversion is an intense dislike of a food and should not be ignored. It could be a sign of food allergy, but that's unlikely. Jumping ahead to the teenage years, there are really 2 important minerals that I want you to focus on. There are increased needs for both iron and calcium during the teenage years. And teenage girls, starting with menstruation, are at the greatest risk for iron deficiency. Since milk has been squeezed out by sodas in today's youth, the chances that teenagers will build up their peak bone mass significantly drops. And lastly, a couple of important points about nutrition in the older adult. For starters, a higher BMI is recommended for individuals over the age of 70. This is actually associated with a lower death rate. The need for fiber actually decreases over the age of 50, but many over the age of 70 do not come close to their needs, and with the GI mobility decreasing, this becomes a problem. Vitamin A is the only vitamin which absorption increases with age. Vitamin D absorption decreases with age, and the recommendation doubles over the age of 50 and triples over the age of 70. Iron status actually improves, the only time in the life, but calcium absorption decreases. Okay, that's it for these two chapters.